Williana. Alright, so good afternoon. I know it's quite late and you're probably very tired and eager to go home. Unfortunately, my talk will not be as fun or I don't know, educational as the others. It's quite technical, so it's probably going to be very boring, but I hope that you will be able to pick up a thing or two. I will be talking about nurturing wellness in schools, okay? And it really has a lot to do with putting together a mental health program for organizations. And of course, a school is one type of an organization. So usually when we talk about mental health in educational settings, topmost is what? We think about students, right? And teachers who work with them. But of course, when you talk about the school setting, who else is in that particular community? You have your staff, right? You have other professionals. It's a community of people. So when you think about putting together a mental health program, I hope you don't just focus on students and teachers' mental health and well-being. Imagine how your food will taste like if your kitchen staff are problematic, right? Imagine how the school will look like if people who work together to make it beautiful are problematic, right? So it's everyone's concern and everyone should be included in a comprehensive mental health program. Okay, so the reasons why we need to create a healthy workplace. Okay, it's the right thing to do. Okay? It's just right for us to put together a comprehensive mental health program. When you think about schools, as mentioned, we usually think about students and we want them to succeed academically, right? That's the first thing. Kailangan magaling yung estudyante. Kailangan matalino. But as Sir Lee mentioned, right, they also need to be what? Emotionally, psychologically, even spiritually what? Whole. Same with teachers, same with other professionals and staff. It's the smart thing to do. Imagine what will happen if students are always absent or are present but not really there with you. The same way with employees. You may have teachers in the classroom but are distracted and not able to really teach well. Right? So it's going to be problematic and it will translate to what? Losses for the school as an organization. So it will entail loss, and you don't want that. Finally, it's the legal thing to do. We are mandated as an organization to put together a mental health program, right? In fact, it's embedded in our law. How many among you have read the mental health law? Whether it's by the Department of Labor and Employment or the Civil Service. Have you read it? Not yet? Okay. Probably you think, parang hindi ko naman problema yun kasi hindi naman ako, di ba? Hindi naman ako yung boss or something like that. But really the mandate is this. Okay? Employers, so owners of schools, right? Okay? As a business or as an institution, okay, should develop appropriate policies and programs on mental health in the workplace. Designed to, so you can probably change some of the words and think about how teachers or how other people in the organization can work together to raise awareness on mental health issues. So our students need to know about these things as well, right? They need to understand what are mental health issues. Is that something relevant to very young children? Yes. Okay. Mental health and mental health issues are not just for adults. Anyone, wherever they are in the lifespan, okay, need to understand what all of these are about. Okay? We need to have programs that will correct the stigma and discrimination. My son was talking about how a group of boys in his classroom, okay, would get the things of another classmate and hide it in different places in the room. And I think the boy, I don't want to call him a victim, but the boy whose things are getting lost, no? Parang it's been a week, or it's been going on for quite a while. So I asked my son, because we talk in a way that they understand the terminologies, because his classmate in the spectrum, and he knew what I meant. And he said, I think so. I think so. So maybe that boy was being picked on, because they knew that if they did something to him, he would react a certain way, and it was probably fun for them. For the boys who were, hiding his things. Kaya problematic. And if the boys doing that have no understanding of the effect, right? For them it was fun, but it can actually be what? Considered bullying already. Okay? So I think it was the administrator who went to my son's classroom, okay, was reprimanding them and telling them, you know what, if nobody admits to it, we will give the class a demerit. My kawawang son, who has never been a leader, but is now the president of the class, was so problematic. Like, what will happen, mommy? We cannot have a demerit as a class. That would be very unfair. So now it's everyone's problem, and everyone is just getting stressed. Right? So, walang bata, walang matanda. When you talk about mental health and all of these things that may happen. Okay? You need to be able to identify and provide support. For students, they're very lucky because they have the guidance office. Right? What about teachers? Where do you go when you're problematic? To your room. Maybe to your colleagues, right? If you're very lucky and you can access mental health professionals, fantastic. But if you can't, even if you can, but if you don't have the budget for it, right? It can be very expensive. But employers need to find ways to help, right? People in the organization to access that. Okay? Yun, number 4, no? Ay, sorry na, nag-skip ako. Yung number 3, how do you know if someone is at risk? Can you tell? Can you tell if someone is at risk? When you observe someone, nasasabi mo parang may something, right? Parang may... I think it's something that you develop when you're exposed to people with mental health issues. They will have certain signs and symptoms, diba? At some, you're not looking for disorders, you're not diagnosing. But you kind of have a sense of when people are not really well, right? But this has to be a bit more formal, especially because you want to be able to detect or identify them in order to intervene at the right time. You don't want to wait when it's too late. Because by then, the problem may be more difficult to manage. Okay? So the benefits from an individual's perspective, okay, it will create a balanced lifestyle. Okay? From the school's perspective, yan nga, no? It can be equated to what? Peso and dollars or whatever have you, di ba? Parang yung economics na mangyayari if a particular workplace is unhealthy. Okay? Moreover, a comprehensive program means that you are mindful that in a particular workplace, no? Just like the spectrum that Sir Lee was presenting a while ago, ganon din ang mental health. Okay? When we think about mental health, we normally think about people who are sick or problematic. But when you talk about a comprehensive mental health program, you are also paying attention to people, to employees or students who are healthy and thriving. Right? We don't just say, oh, you're okay naman, you're happy, you're an honor student, sige, go do your thing. Okay ka na, hindi ka na namin kailangan pansinin or alagaan. Hindi, lahat yan. You want them to stay there, or if they move in the spectrum, there's a way for them to bounce back, as Sir Lee was saying, okay? And to minimize the progression to the very end of the spectrum. Okay? You don't want your programs to be targeting those at the, from your perspective, from the rightmost. Mahirap na yan. That's going to be so challenging for any organization to think about programs na you will bring back people and help them recover. So prevention is going to be very important. Now, the key components, ito na, this is the medyo technical stuff. Okay? When you put together a comprehensive mental health program for your own organizations, or if you're going to be part of the task force or the team, okay, all of those should be in it. Many of the talks, no, you heard the whole day this day, okay, will probably fall under the category of strategies, right? You have art therapy, you can have resilience building trainings or workshops, or whatever have you, diba? Ang dami yung pwedeng gawin. But it's not enough that you have strategies. It has to come together into an integrated program. Okay? So I will not talk about the rational and the objectives. That's something I'm sure you know already. Okay? When you talk about coverage, so who will your program or your policies cover? Okay? Is this something that students can access? Is this something that all employees can avail of? And when you talk about employees, I'm sure you have permanent employees, you have full-time, you have contractual, right? So sino lang ang pwede? Who can access support? Everyone? If you say yes, fantastic. But is that realistic? Maybe not. Because it can be very expensive, right? But if you will adhere to the thinking na nobody gets left behind, paano yun? Diba? So you really have to be mindful of, so how inclusive will my program be? Okay? But of course, you have to also be very, very mindful of these two things. Okay? Whatever program you get to put together, you have to put a premium on making sure that nobody's rights is violated. Whatever the program may be. Okay? You have to uphold that. Okay? People with mental health issues, especially because they are vulnerable, and however you wish to address it, you have to commit to your own institution's standards, code of ethics, and professional ethics as well. Diba, teachers may ethics kayo, diba? Sa psychologist may ethics din. Pero wala naman halos pagkakaiba yan, diba? Pare-pareho lang. These are what? Guiding principles, so we do no harm. Bottom line. Finally, we have to make sure that when we think about policies, these are going to be non-discriminatory. Okay? And I'm not talking about gender or what have you, no, none of those things. I'm talking about, okay, policies that will ensure, when you think about accepting students. Some schools are very wary of accepting students with diagnosis, right? Why is that? Yung masakit na ulo yun eh, diba? Hirap mag-alag, diba? Hirap pag hindi kayo equipped. That's going to be, oh no. Employees, would you hire a teacher with a diagnosis? No. See, right away, no. And that's a very realistic. If it were up to me, if I will not put on my psychologist hat, sasabihin ko din, masakit sa ulo, wag na lang. Diba? It's really going to be very difficult. But the law is telling us you cannot discriminate. That cannot be the reason for you to not accept them, not promote them to the next level, or not promote them to the next rank. Okay? In terms of access to benefits, you cannot suspend students or expel them, especially if the reason for the misbehavior, quote unquote, is due to a mental health issue. You cannot. That will be against the law. Unless you want Tulfo to knock on your door. Please don't do that. The same way, you cannot terminate your employees because of a mental health issue. You have to make sure that you have done the proper type of care, right? You have accommodated, you have exhausted the possibilities, and talagang sa dulo, hindi kasi talaga kaya. Then that will probably be a good basis for you to, what? Discuss separation. Because they really cannot do the work. But not because they're absent, but not because, they're not performing very well. Not at that moment. You have to show that you've done something first to take care of that person. Okay? When you think about policies, you have to make sure that you are able to articulate goods. My husband, who is, as I've mentioned, also a clinical psychologist, it's not unlikely for him to get requests for a mental health clearance for college students, for instance, right? Some schools will require a student with mental health issues to get a clearance first before they will be allowed to enroll. Okay? If that is something that you would want to do also, you have to make sure that when you accept these students, okay, at the onset or when you allow them to return, you are ready to have them in your institutions, right? Huwag kayong tatanggap pag wala naman kayong paraan para suportahan. Because that will be what? The perfect recipe for disaster, right? If you cannot accommodate, then think about it. When you ask students or employees to, return to work, make sure that they are getting that certification from the right individuals. In some instances, it can come from a medical doctor. But it can't be just the medical doctor. If it were a physical ailment, I'd understand that. But if it's a mental health issue, it is only right that a psychiatrist or a psychologist be included in that conversation, right? You don't go to a psychologist if you have diabetes or if you have thyroid issues, right? You go to the right person because they would know what to do and how to help you, right? I remember, I'm sorry, I'm so talkative, I just, bear with me. I remember one employee who was made to get a certification. He went to a medical doctor who said that he was just stressed and was told, matulog ka, tulog mo lang mga 2 weeks. Siyempre, when he came back to work, the issue was not resolved. So the organization was really feeling problematic. Kasi parang, what happened? Siyempre, hindi. Okay, that's it. That's all I'm going to say about that. Okay? Confidentiality, something you know. We keep things sacred because we want to protect the people who are already experiencing vulnerabilities. Okay? If the information has to be shared, you don't randomly share it or you don't share it to everyone. If it's a teacher and it has to be with the HR, not everyone in HR should be able to read that, right? Certain people can access the information, but it's not for everyone's consumption. Okay? And when you talk about disclosure, can you ask an applicant or a student to disclose if they have mental health issues? If they're applying as a professional or as a student? Can you ask the parents, may I know if your child has a diagnosis? Or can you ask a potential teacher, may diagnosis ka ba? Pwede ba tanongin yun? Are you allowed? No? What do you think? It depends. The sophisticated answer is it depends. Pero pag na-observe, kasi it means you've spent quite some time with the person, pero mag-applicant pa lang right?
We have a sort of like evaluation, so we would observe a child in the genuine classroom setup.
Okay, so if you have that, you have the luxury of time, fantastic. But if it's a teacher, it may not come out, right? Not all problems are visible. So can you ask? You need to know why you're asking. It has to be clear to you. Is the reason for asking because you just want to have that, extra elbow room para, naku, baka pwedeng wag ko na lang tanggapin. Diba? Or is it because you want to genuinely understand that person's context so that you as an institution, you can tell if you're ready, if you can accommodate them. Right? Because for instance, you're going to accept special children or children with some vulnerabilities, pero you're such a trad school, for instance, right? With no room for, parang wala kayong intervention. Kawawa again yung bata. Diba? So it's not because you're trying to be a marites, but it's more because you want to be equipped. But the best thing to do is to what? Consult your legal office, right? Just so you are properly guided. But you can. As long as it's done in a very respectful and sensitive way, and you're able to handle the information. Okay? Now, we talked about confidentiality, but there are also limits, right? When the person is already posing a risk to himself or herself, to others, it's mandated by law, and all of these things. So it's not like an absolute, everything is confidential. Meron tayong space also to move. Okay? So, make sure that your students or employees' rights are always upheld, okay? And also that your programs are sustainable. We find certain programs really attractive to adopt, but in the long run, it's not something that we can continue. It may be too expensive, so you have to be realistic. Okay. Now, we talk about strategies. Lahat ng narinig nyo sa araw na to, sa tingin ko, in one way or another, will fall under this category. Okay? So, yan. Okay. Activities that will ensure prevention, promotion, information campaign, okay? Facilitate treatment and recovery, and all of those things. Ito na. Okay? Putting together a program is the work of a community. It is never the principal's job. The principal or the assistant. It is never the teacher's job. or the guidance office, or just the HR. It is everyone's responsibility from the top all the way to the followers and staff. Okay? It's not an individual effort. So you need to have an implementation mechanism. Who will do what at particular times? How will this be carried out? And all of these things. Dapat klaro. Okay? Dapat klaro. And then, no, sabi nga natin, it's everyone's business, so where are the students? I'm probably, making you fall asleep, but when the time comes that you need to be consulted, right? Participate. Because it's your business. You are the major, stakeholder, not stockholder. Stakeholder in the institution. You are the primary client. So you need to be part of the conversation. Okay? How will people know that there is such a program? In many instances, employees will say, ay, may ganun pala. Ay, hindi ko alam meron tayong ganung program. So they're trying to find ways to support themselves, not knowing that the organization can actually be of help. Okay? And finally, there should be a way for you to monitor and evaluate your programs. Every so often, check what is working and what is not working. Right? You don't want to keep on implementing programs that nobody is participating in. Sayang sa pera. Sayang sa oras. You want to implement what works. And how will you know it works or it will work? It is anchored on what your students and employees need. So you have to start with that. It has to be needs-based for it to be responsive and meaningful. Okay? So as mentioned, it cannot be done by a few people. Okay? It doesn't have to be expensive, right? It's not about getting experts and making them talk and all of these things, right? Hindi siya kailangang fantastic efforts. Know who are within the community. You may tap them, okay? Capacitate them, train them, and you wouldn't have to constantly spend just because it says it's a strategy or it's a program. Okay? Kaya nyo naman yan from within. Right? And at the end of the day, simple ways of showing that the organization is one with its employees and students, okay, is already a major step forward. So, if I were to ask you, do you have a mental health program in place in your own schools? Do you? Do you? Do you have mental health programs? Are you aware?
Yes.
Are they done? Tapos na? Paano yung nabalitaan ko pala? So it doesn't, okay lang yon. Okay lang yon. You may be in the, parang ang patawag dyan, thinking about it zone, all the way to completed mental health program. It doesn't matter. As long as you have these principles in mind, okay, I hope that you will continue the conversation with each other and end up putting together a responsive and meaningful mental health program so that everyone will feel cared for and nobody gets left behind. Thank you.